Hey guys, in our QI project today we're going to be talking about the length of stay in patients admitted for acute decompensated heart failure, and we are going to be trying to identify contributing or modifiable variables. This is DMC Huron Valley Sinai Hospital, the Internal Medicine Residency Program. So the variables we're going to be looking at are BNP of above 250, IV diuretic use, cardiac diet versus non-cardiac diet, and evidence of pulmonary vascular congestion on imaging studies. And we're going to try to look. So we are going to be retrospectively analyzing data on patients who were admitted for acute decompensated heart failure, and the length of stay is going to be defined as the time from the first set of vitals registered in the EMR till the last time vitals were registered. And only patients admitted for acute decompensated heart failure as an admitting diagnosis will be included in the study. So patients who are admitted to the hospital with a different admitting diagnosis will be excluded from the study. Other exclusion criteria will be no documented history of heart failure and or no baseline diuretic therapy for heart failure, admission to any other floor other than telemetry, any antibiotic therapy started during hospital stay, any treatment for acute COPD exacerbation, patients with end-stage renal disease on hemodialysis, or patients requiring dialysis for any reason, and finally patients who were given oral diuretics. No BNP level on the patient. So the primary outcome of the study is to examine the confounding variables that may or may not contribute to the length of stay in patients admitted to the hospital with acute decompensated heart failure. So after analyzing the data we had, we got the following results. Average length of stay is 9.3 days. Cardiac diet length of stay is 7.8 days. Non-cardiac diet length of stay is 12.2 days. So in conclusion, in those patients with heart failure who are receiving IV diuretics, length of stay can be shortened if maintaining a cardiac diet. And in contrast, those who had non-cardiac diet but still received IV diuretics, average stay was increased. So the best way to impact length of stay would be to optimize patients with low sodium diets, especially those patients who would benefit the most from lower salt loads, and those are heart failure patients. Thanks for watching the video, guys. We hope that this provided some insight on heart failure and the implications of controlling modifiable variables, like for example diet.